What I wanted to talk today about is the liver. Now, the liver, I think, is in the category of one of the unsung heroes of the body. You don't really think about it that hard, and it doesn't get a lot of attention compared to all the time and effort that we spend focusing on the lungs and the heart, and because we like to talk about shock when we're talking about transport, which, I guess is important, but at the same time, there are other organs out there. And like the kidney, some of them don't get the attention I think that they truly deserve. Now, the liver is the second largest organ in your body. The largest one is your skin, but the second largest is your liver. So, it's pretty big and actually kind of impressive that it's just hidden up here right underneath your rib cage and, protected well by your rib cage. And if you can't even really feel it unless you kind of slip your fingers underneath your ribs, and unless you're ticklish, then don't poke too hard. But it's right up under there, and when you breathe down, you can actually feel the edge of the liver coming down and touching your fingers, which is kind of neat. There's not a lot of organs that you can really kind of feel for yourself that are deep inside your guts without using the magic of ultrasound. So there are two main blood supplies to the liver. One is the hepatic artery, which we're not really going to talk about in a lot of detail. It basically supplies the blood's oxygen to the liver and is the main blood supply for nutrition for the liver itself. But the most important of blood supply is the portal vein. The portal vein is a collection of all of the blood that comes from everything from your esophagus, your stomach, your spleen, your pancreas, small intestine, large intestine. Everything from those organs is collected by the portal vein and goes into your liver. And that's a good idea because basically anything that gets into your body goes to your liver first. And that's when the liver can do its work on that stuff. Now, the functional unit of the liver is the lobule. Now, just like where in the kidneys, the nephron is the functional unit, in the liver, the lobule is the functional unit. And the lobules are divided into these hexagons, where there is on each of the points of the hexagon, there's a blood supply. There's the hepatic artery and the portal veins that runs along it and sends little capillaries inside all of into these hexagons, into these lobules, and past all of these sheets of liver cells into the central vein, which is sort of collecting all of that blood to return it to the hepatic vein, which is the vein that drains the blood from the vein and puts it into the inferior vena cava to return it back to the heart. So this is all interesting. Sure, the blood supply of the liver is kind of neat, but we're not here for an anatomy lesson. We're here for a physiology lesson. So the question really is, what stuff does the liver do? Well, the liver is very complicated, and there's lots of stuff that it does. But in order to kind of help you organize it, I've looked at it in 5 different ways. The liver makes stuff, stores stuff, it dumps stuff, digests stuff, and it kills stuff. So what kind of stuff does the liver make? Well, a lot of stuff, and I could overwhelm you with all that stuff. But instead what I want to do is just focus on a couple of things that the liver makes so you have an understanding of the breadth the liver is responsible for making. Now, as you know, the body needs a continuous supply of glucose, and the liver, one of its most important functions is what we call gluconeogenesis. And this is the ability to make glucose from practically anything, other sugars, proteins, amino acids, fats. You give it anything, the liver can make glucose out of it because that is a really critical first basic function of the liver. The liver also receives a very large amount of fat or triglycerides from the diet that we consume. And one of the things that it has to make is a way to get rid of all of that or package it. So what the liver does is it takes all of these triglycerides and packages them up because lipids, as you probably are aware, don't dissolve in water very well. And so to manage that, the liver makes glycoproteins that package these triglycerides up and then allows them, based on other little proteins that it'll put on the surface of that package, to be picked up and transported to other cells like adipose tissue to be absorbed there and stored. So the liver is responsible for making these packages of lipids so that they're ready for transport and for storage elsewhere. Now the liver, like any other cell in the body, is able to make practically any protein that's embedded in our DNA. But what's different about the liver is it can make any amino acid that is needed in order to make those proteins. And so the liver has a critical function in helping ensure that there's a continuous supply of amino acids for all of the cells of the body to help with building protein, and also helping produce some of the essential amino acids that other cells just can't make on their own. And lastly, and most importantly, are the liver's ability to produce a lot of the plasma proteins. And probably the most important plasma proteins that we need to deal with in transport are the coagulation proteins. The liver makes all of those proteins from all of that pathway that you were forced to memorize. All of those factors come from the liver. When the liver fails, you get coagulopathic. Another essential job of the liver is to store stuff. And there's a number of things that it stores, and it uses this as a way of acting as a buffer to ensure that there's a continuous supply going on throughout all of the time, no matter what circumstances or what environment you're being exposed to. The liver is primarily responsible not only for making glucose, but also for storing glucose. And the way it stores glucose is by forming it into long chains called glycogen. And it stores this glycogen as a way to act as a buffer from times when we don't have a continuous supply of glucose flowing in our bodies. So the liver is responsible for ensuring that even when we're not eating or if we're fasting, that there is always a source of glucose somewhere that it can readily break down quickly and fire it into the blood and deliver it to the rest of the body as needed. It's also a very well-tuned system that as glycogen levels start to decrease, it starts then drawing on other sources of energy, like fats, to start forming glucose from those elements in order to ensure that there's a constant supply. Now, most people don't appreciate that one of the other things about the liver is it acts as a storage unit for iron. Now, I don't know about you, but I personally think fried liver is gross and I would never touch that stuff. But back in the old days when parents forced their children to eat that garbage, they were told, it was a good source of iron. And I think over time we've kind of forgotten that the liver is a really good source of iron, because what it does is it acts as a storage unit for iron. And it takes in all of your elemental iron that you've consumed in your diet and stores it and makes it available for the production of hemoglobin down the line in your bone marrows. Now, one thing that's really neat about the liver is that it has the ability to sense when the body is under threat from attack by bacteria. And when the liver senses that it is infected and there's something going on, it actually starts absorbing as much iron out of the blood as it possibly can, because bacteria need that iron for their own reproduction. And the liver uses this as a defense mechanism to try to deprive the enemy of a source of nutrition. And so it's really neat that as a response to an infection, the liver becomes a bigger storehouse for iron to try to hide it away from those bad boys who are trying to kill us. One of the other important functions of the liver is to dump stuff, by which I mean it detoxifies the body. It takes substances that are harmful to us and gets rid of them. And it does this in concert with the kidneys. Now, despite what naturopaths and other practitioners of the dark arts will tell you, detoxifying your body is actually not that hard. You can break down toxins into two categories: those that are hydrophilic and those that are lipophilic. Now, things that are hydrophilic, meaning they love water, means that they can be dissolved in water. Things that are lipophilic are things that love to be in fat and don't like to be in water. And so they're called fat soluble. Getting rid of hydrophilic or water soluble toxins is dead easy. We talked about them. It's the kidneys. All you do is flush them out. Piece of cake. Now, the challenge is dealing with the lipophilic or the fat soluble toxins, and that's where the liver really shines. So this is really one of the neatest things. When I learned about how the liver functions, it really just blew my mind, because this is so elegantly simple and yet brilliant that I was in awe. It was incredible. You have a problem. The liver has a substance that is fat soluble. You can't flush it into the kidneys because it won't go in the water, it won't dissolve. And so the liver takes this substance and says, the way to fix that problem is to make it water soluble. And the way to make it water soluble is to add a water soluble chemical to it. And so there are 4 different reactive molecules that can be added to these toxins that makes them water soluble. Now, I'm not going to go into all the different chemical steps, but suffice it to say, the liver basically takes this chemical, this toxin, this evil humor, and it looks at it and it goes, well, this has an aldehyde group attached to it. That's pretty reactive. I'll add a acetyl group to it because that'll make it water soluble. And then it does that. And in doing that, takes the toxin that is fat soluble, makes it water soluble, and then it's off to the kidneys, and away it goes. Piece of cake. Brilliant, simple, but oh so elegant. So a really neat example of this detoxification is how Tylenol is detoxified, because Tylenol itself, interestingly, is not actually dangerous. It's not toxic to the body. It's when it's metabolized, that's when it becomes dangerous. And so the liver, when it's exposed to Tylenol, is now dealing with something that's relatively fat soluble. And so it looks at it and goes, okay, there are a number of different ways I can manage and get rid of this. And the vast majority of the way it's going to metabolize this is to add on a sulfur group or sulfonation, or it's going to use gluconeogenesis to attach a molecule that is going to make it water soluble, and then off into the kidneys and away it goes. Now, 90% of all of the Tylenol that is consumed follows that pathway, but only 10% follows an alternate pathway. And this is using the mitochondrial P450 pathway. Now, these are very common ways in which substances are metabolized in the body. Cytochrome P450 will take Tylenol and it will, as one of its steps, convert it into a substance called NAPQI. Now, this substance is really toxic. It's really bad for your body. Fortunately, that is only an intermediary step. The next step is to add a glutathione group to that toxic substance to make it water soluble. It inactivates it and it's off to the kidneys and it's gone. No problem. Why is Tylenol toxic to the liver? Well, even though 90% follows this other pathway that's completely safe and harmless to the body and gets rid of the Tylenol, 10% follows a pathway where there is a toxic intermediary that has to be addressed, and that the substance that is necessary, glutathione, can be depleted if somebody overwhelms their system, so they take a massive overdose of Tylenol, or if they're malnourished to begin with, and so they don't have adequate stores of the substance to add to the NAPQI substance. And if there isn't enough of it, this toxic substance is now basically like a reactive oxygen species, and it starts looking for trouble, and it starts binding itself to all kinds of plasma proteins inside the liver itself, and it kills the liver. So this is why when we have somebody who has a Tylenol overdose, we give them mucimist or N-acetylcysteine. This is the substrate that helps regenerate glutathione, which is necessary in order to make the NAPQI, which is really toxic, water soluble and non-toxic, so they can go off to the kidneys and bye-bye. Really neat. I think that this is a great example of how the liver can manage a wide variety of toxic substances without using a lot of different complex pathways. These are 4 simple pathways that manage everything that you can consume. And despite all of the things that the naturopaths tell you, toxins are easy to manage. The liver does it all the time without a fuss. Another important function of the liver is to assist in digesting. As you know, our diet contains fats, and fats don't dissolve in water. And when they don't dissolve in water, it's kind of hard to digest them. So the liver assists in the digestion by producing bile. Bile is what we call an emulsifant, which basically takes these fat that the body has been digesting and makes them into and breaks them down into smaller globules so that they can be absorbed into the bloodstream. And once they're absorbed into the bloodstream, they go to the liver, and once they're inside the liver, they can be metabolized and put into these lipoproteins and packaged up so they can be shipped off for storage. So the liver has a really important job as part of digesting fats in addition to just storing the fats. The last important function of the liver is as an immune organ. One of the other really important functions of the liver that people don't actually really appreciate is it is an immune organ. It's really important in your immune system. And that makes sense because consider, the portal vein drains everything from your esophagus down to your poop chute. And that area is chock full of bacteria. Bacteria that are just kind of hanging out, and they know better to just hang out in the gut, and it's all good, and you won't hurt me and I won't hurt you, and maybe you'll help me and I'll give you a nice little place to live. But we also eat bacteria and viruses as part of our normal diet. We don't intend to do it, but we just do. They're in the environment and we consume them. And so because the portal system brings everything to the liver eventually, the liver has to act in some way as an immune organ. And it does, and it's really neat. So imagine, if you will, bacteria getting into your gut, not knowing any better, not listening to the neighbor saying, hey, dude, seriously, this is a nice place to hang out. If you lay low, you can just live here and it'll let you. If you get into the blood, there's going to be trouble. And that bacteria doesn't listen because, Campylobacter's a stupid idiot. And it gets into your blood, it gets into your portal system, and wham! Inside the portal system, there's a whole bunch, inside all of those little capillaries that are investing all throughout the lobules, there's macrophages that are just waiting to have a nice little Campylobacter lunch. And so the liver has a very important role in your immune system as a first step in clearing out bad things that get into your blood, and because these are macrophages, they act as antigen-presenting cells to alert the rest of the immune system as to what's going on out there. So it's an early warning device against infection. So that's all well and good. The liver has a lot of really important functions, but you probably are only marginally interested in all of those functions, and probably also would like to know what happens when the liver fails. Now, liver failure can get a little complicated because there are kind of 2 ways in which the liver fails. It can fail acutely, or it can fail chronically. And if you don't really have that system set in your head, you can kind of get confused. So the first and most important cause of failure is acute liver failure. Okay? Acute liver failure can be caused by a variety of different things, and the list isn't actually that long. You can get an acute liver failure from a viral infection like hepatitis B or hepatitis C, toxins like Tylenol, you overdose on that, and that's very toxic to the liver and it will acutely fail. There are a variety of other hepatotoxins out there. Probably the most important and under-recognized are all of those naturopathic medications, some of which are insanely toxic to the liver. And let me tell you from personal experience, when you try contacting these naturopaths and ask them questions about the things that they prescribed to the patient you're looking at who's in acute liver failure, they'll deny it, that there was ever a problem. In fact, I had one guy actually say that the medicine that he prescribed was actually to help cleanse his liver. And it did. It actually did a great job. It cleaned the liver of all of the liver cells. There were none left after that substance got into them. There can also be idiosyncratic drug reactions. And the anesthetic halothane is one of the most well-recognized causes of acute liver failure as a drug reaction. You can also get liver failure if the patient has been hypoperfused. They get hypotensive, shock, cardiac arrest. These are things that we commonly see as a rise in their liver enzymes soon after they have returned to spontaneous circulation because the liver's taken a hit. And then lastly, you can get acute liver failure from pregnancy. Well, not from pregnancy itself, but there's two conditions. One, HELP, hemolysis, elevated liver enzymes, and low platelets, which is a form of liver injury and a TTP. And then you can also get an idiopathic condition called acute fatty liver pregnancy, which occurs at the end of the pregnancy. But is unusual, but is a known complication and risk for developing acute liver failure. Now, the definition of acute liver failure is that it has to be liver failure that has occurred in less than 26 weeks. And in fact, the vast majority of these occur very quickly. If they occur within 2 weeks of presentation, then it's called fulminant hepatic failure. The hallmark of acute liver failure is the absence of cirrhosis. There should be no cirrhosis because the liver hasn't had time to develop that. Patients will present with an encephalopathy. They will have right upper quadrant pain usually, and they will also have a coagulopathy because the coagulation proteins are important proteins, but the liver is currently failed and can't produce those things, and so they'll manifest with a bleeding disorder. Now, if you compare that to chronic liver disease, which you've probably seen because these patients, it's actually a fairly common diagnosis, present with a variety of different causes. Now, there's a long list, but really the most important 4 things that can cause chronic liver failure are hepatitis C, alcohol, hemochromatosis, and NASH. And hemochromatosis is kind of neat because, well, kind of neat if you don't have it. The hemochromatosis is a hereditary iron storage disease where the liver doesn't know that it needs to actually let go of all of the iron that it's been storing. So it just stores up and eventually the iron kills the cells. Now, the hallmark findings for chronic liver disease is cirrhosis. And cirrhosis is important because it leads to portal hypertension. Now, cirrhosis basically means you take a bunch of liver cells and you kill them off and you replace them with cells like fibrotic cells that just basically scar down the liver and kind of gnarl it all up and like this. And then when you do that, because there's a very large vein, which is a low pressure system by nature, that feeds into that, and that blood is now being forced into a high resistance area, the liver. And so the way that, so pressures being what they are, if it backs up down into the portal system, you develop portal hypertension. And portal hypertension means that the blood has to find alternative routes back and out of the system and back into the heart. And so one way that it'll do that is it'll feed its way back up into the esophagus and the stomach, and it will cause varices there. And so these are the people who present with esophageal varices. People with acute liver failure don't get varices because they don't have cirrhosis and they don't have portal hypertension. They are coagulopathic because they're not producing plasma proteins, but at the same time, chronic liver failure patients are also not producing enough plasma proteins and and they'll be coagulopathic as well, but generally to a lesser degree. Their INR will be elevated, but not sky high. Portal hypertension leads to a lot of other consequences, such as ascites and all of these other findings of chronic liver disease, such as the caput medusa, the little, the umbilicus. You can get a little, little thing of blood vessels popping up there. You'll get these little caput medusas. And you'll also have jaundice. And jaundice is not directly related to the cirrhosis, because people with a longer course of acute liver failure will develop jaundice. But patients who have chronic liver failure have time to develop the jaundice. The jaundice is a consequence of the breakdown of bilirubin. Now, bilirubin comes from the hemoglobin molecules. When a red blood cell comes to the end of its life, that hemoglobin molecule has to be metabolized. And the way it metabolizes it is just like with any other toxin, it's got to be made water soluble. And so the liver then starts to attach it and metabolize it to make it water soluble so that it can get rid of it. And it can get rid of it by two ways, actually. One, it can make it water soluble and it can go into the pee, and that's what makes your urine yellow. Or it can put it into the bile and then just kind of excrete it out into the poo, and that's what makes your poo brown. So if there's anything you get out of this whole talk, now you know why your urine is yellow and your poo is brown. So you can log out now if you're done, because you basically have learned all the important stuff. So anyways, the point being, chronic liver failure presents chronically, and you've probably recognized it. There are a wide variety of different things that can cause it, but the hallmark is cirrhosis and portal hypertension with some jaundice on top of that. You will sometimes be asked to transport patients who develop an acute on chronic liver failure. So these are people who will get acutely encephalopathic because they've been indiscreet in their diet and they have a lot of excess ammonia in their blood because their liver is not metabolizing ammonia properly, and so protein metabolism has failed, and so ammonia builds up, and so they become acutely encephalopathic, and then they lose their airway. Or they can develop an acute alcohol hepatitis on top of their chronic cirrhosis from their alcohol. These are all common acute on chronic presentations that you have to be aware of. But to understand liver failure itself, just break it down into acute things and chronic things. So the liver is really one of those more fascinating unsung heroes of the body. And in reviewing this topic, I was struck by the beauty of the liver, and it brought in me a poem. So behold the mighty liver. It does a lot of stuff. Despite everything you give her, it never quits in a huff. Ugh, that was terrible. I need a drink.